Everyone, and welcome back to I'm your host Dr. Geetanjali Pareek, and as we have said earlier, I would be taking up the generalized anxiety disorder today. So as the name implies, generalized anxiety disorder is a chronic, or you can say so, an ongoing state of diffuse or free floating anxiety that is not attached to a specific situation or object. Fine, so it is not like I'm anxious because of this. It's not that, but you have that anxious feeling all over the time, most of the time. So the anxiety may last for months, with the signs almost continually being present. Now, though anxiety is a normal and adaptive response to threat that prepares the organism for flight or fight response, persons who seem to be anxious about almost everything, however, are more likely to be called as having generalized anxiety disorder. So, in case we have to describe generalized anxiety disorder, it could be defined as excessive anxiety and worry about several events or activities for most days, at least for 6 months period. Means for the last 6 months or so, you have that anxious feeling, not at a particular event, but most of the events in your daily life. The worry is difficult to control and is associated with somatic symptoms such as muscle tension, irritability is there, difficulty falling asleep, or restlessness. Then this anxiety is not focused on features of another disorder, like it is not because of certain substance you use, or because of the general medical condition, or because of any other psychiatric disorder, moods, swings, etc. It is not because of that. It is just your general anxiousness which you have. Then the anxiety is difficult to control, is subjectively distressing, and produces impairment in important areas of person's life. So the person feels impaired. So for example, let's take an example of a person, his name has been changed, let's say it's Radhesham. So emotionally he feels jittery, tense, and constantly on edge, and cognitively he expects that something awful is going to happen, and he doesn't know why he feels so negative about it. Physically he perspires constantly, his stomach is upset, and he usually is unable to have a comfortable sleep. Now, as we might expect, this disorder can markedly interfere with daily functioning, even if the symptoms are not continually present for 6 months required for the formal diagnosis. The person may find it hard to concentrate, to make decisions, and to remember commitments. People with these conditions, 2/3 are mostly women, and they worry continually, and they are often jittery, agitated, and sleep deprived. Concentration is difficult as attention switches from one worry to another, and their tension and apprehension may leak out through furrowed brows, twitching of the eyelids, trembling, perspiration, or fidgeting. One of the most characteristic of this disorder is that the person cannot identify and therefore cannot deal with or avoid its cause. Why he is feeling so anxious? In Freud's term, the anxiety is free floating. Generalized anxiety disorder is often accompanied by depressed mood, but even without depression, it tends to be disabling. Moreover, it may lead to physical problems such as ulcers and high blood pressures. Many studies have indicated that many people with generalized disorder were maltreated or inhibited as children. Now we go on to the epidemiology. Generalized anxiety disorder is the commonest psychiatric disorder in the population, with the reasonable estimates for its 1-year prevalence range from 3 to 8%. The ratio of women to men with the disorder is about 2:1. So we can say so the women's are twice that of men, but the ratio of women to men for receiving inpatient treatment for this disorder is 1:1. That is, inpatient treatment, both receive the same amount of treatment. Lifetime prevalence is close to 5%, with the epidemiological catchment area, that is ECA studies, suggesting lifetime prevalence as high as 8%. In anxiety disorders clinics, about 25% of patients have generalized anxiety disorder. The disorder usually has its onset in late adolescence or early adulthood, although cases are commonly seen in older adults. But however, as the time passes, the studies have shown that around by the age of 50 years, it tends to general anxiety disorder, it becomes rare. Maybe they are more relaxed now. Earlier they had more stresses of life. Now we go on to the comorbidity. Generalized anxiety disorder is a disorder that most often coexists with another mental disorder, usually social phobia, specific phobia, panic disorder, or a depressive disorder. Around 50 to 90% of patients with generalized anxiety disorder usually have another mental disorder. As many as 25% of patients eventually experience panic disorder. Means it takes a higher form of it. An additional high percentage of patients are likely to have major depressive disorder. Now we go on to the etiology. So the causes of generalized disorder. So the causes of generalized anxiety disorder is not known, as generalized anxiety disorder affects a heterogeneous group of persons. Certain degree of anxiety is normal and adaptive, and differentiating normal anxiety from the pathological anxiety is quite difficult. Also, differentiating biological causative factors from the psychological factors is also a difficult one. So the main reason or the causes why the person has this is quite difficult. However, there are several theories to explain the etiology, of which more than one may be applicable in a particular patient. The first definitely is a psychodynamic theory. Now, according to this theory, anxiety is a symptom of unresolved, unconscious conflicts. Sigmund Freud first presented this psychological theory in 1909 with this description of little hands. Next theory which explains generalized anxiety disorder is behavioral theory. Now, according to this theory, anxiety is viewed as an unconditioned, inherent response of the organism to painful or dangerous stimuli. In anxiety and phobias, this becomes attached to relatively neutral stimuli by conditioning. Next we have is cognitive behavioral theory, or you say CBT. According to this cognitive behavioral theory, in anxiety disorder, there is evidence of selective information processing. You just select a kind of, not all, with more attention being paid to threat-related information. Cognitive distortions may be there, negative autonomic thoughts about the person's own ability to cope. It all leads to generalized anxiety disorder. According to the biological theory, there are certain, first it's an again group, there are groups of this, according to one, that is genetic evidence, about 15 to 20% of the first degree relatives of the patients with anxiety disorder exhibit anxiety disorders themselves. The concordance rate in the monozygotic twins of patients with panic disorder is as high as 80%. That is 4 times more than in dizygotic twins. Now, it could be because of chemically induced anxiety states. Certain chemicals such as sodium lactate, isopropanol and caffeine, or inhalation of 5% carbon dioxide, they produce panic episodes or predispose individuals to anxiety. GABA benzodiazepine receptors is the most prevalent inhibitory neurotransmitter in the central nervous system. Now, it has been suggested that an alternation in GABA levels may lead to production of clinical anxiety. Other neurotransmitters that is your norepinephrine, 5-HT dopamine, opioid receptors, and neuroendocrine dysfunction has also been implicated to the causation of anxiety disorder. Then there are neuroanatomical bases. For example, your locus coeruleus, limbic system, and the prefrontal cortex are some of the areas implicated in the etiology of anxiety disorder. Organic anxiety disorder. Now, this disorder is characterized by the presence of anxiety which is secondary to the various medical disorders. Example you have is hypothyroidism, phenochromoscytoma, coronary artery disease. They all might lead to anxiety disorders. Now, if anxiety symptoms can occur secondary to medical disorders, it seems possible and that the anxiety has a biological basis. Fine. Now we go on to the treatment part. The treatment of anxiety disorders is usually multimodal. So you can't say that one thing is going to help you out. It is definitely multimodal. The most effective treatment of generalized anxiety disorder is probably one that combines psychotherapeutic and pharmacotherapeutic and supportive approaches. So now we go on to the psychotherapy part. The major psychotherapeutic approaches to generalized anxiety disorders are CBT, that's your cognitive behavioral therapy, supportive and insight oriented. Now, psychoanalytic psychotherapy is not usually indicated unless the person has certain personality problems which coexist. Now, usually supportive psychotherapy is used either alone when anxiety is mild or in combination with drug therapy. Supportive therapy offers patients reassurance and comfort, although its long-term efficacy is doubtful. Insight-oriented psychotherapy focuses on uncovering unconscious conflicts and identifying ego strengths. Then we have relaxation techniques. In patients with mild to moderate anxiety, relaxation techniques are very useful. Patient uses these techniques himself as a routine exercise every day or also whenever there is an anxiety provoking situation. So these techniques includes Jacobson progressive relaxation technique, yoga, pranayam, self-hypnosis, meditation, etc. Other behavioral therapies, they include biofeedback and hyperventilation. And these therapies are also very effective in managing generalized anxiety disorder. As for the pharmacotherapy, it is something outside, but definitely person uses either benzodiazepines and SSRIs for it. So that concludes with the topic, that is the generalized anxiety disorder. Hope you liked it. And in case if you are found you find or you can say you enjoy reading also, the link of that has been given. You can read my blog there, and if you have any comments to say, you can write to me up. Thanks for subscribing also. Bye bye, take care.